This is Arno. He presented to us a few weeks ago to have a lower arch done. He was so happy with the result, he decided that he wanted to have his upper denture fixed in his mouth. So we evaluated Arno with a CT scan. We looked at the available bone, and we can see that he's got a very adequate ridge, lots of bone in all dimensions, width. And our plan for today is to place 4 implants anterior to the sinus and immediately load those implants with a provisional restoration. Just making sure that at the end we have the correct vertical dimension back where we started. So we have a spot to orient to. You want to put a dot on the nose? Close down, Arno, and floor mark it for me. And that's for the total vertical. And we also want on an uppercase to mark the incisal edge where it is when we present at the inside. And that gives us some idea to make sure we're in the correct position. And I'm going to stay a little bit more to the buccal than on the crest, staying within attached tissue as I do it. All the way to the midline. And we'll do the same thing on the other side. Slight release and staying to the buccal. This is a precision drill. We're going to use it to indicate the amount of bone reduction that's required. Okay. So you can see this is the amount of bone reduction that's required. This is the burr that we're going to use for bone reduction. It's going to allow us to create a concave surface on the bone at the crest. And that's roughly where we need it. Well, that would be there. This is an all-on-4 surgical guide to help us with the orientation. There we go. And then we put it down like that, and I'm a little bit more, I'd like to be right there. I feel always, so. The bone feels pretty soft. We're going to utilize a soft drill protocol. We're going to use this drill, the 2.4, 2.8 step drill to depth. The bone's soft. I'm just going to open the crest slightly with it, just to enable me to place the implant. Right spot for? That's about as much as I want to do with that. I've got good bone everywhere. That's going to be, 13's going to be buried a bit. I'd prefer 13, I think. Nobo parallel conical connection, 4.3 by 13 millimeter. Torque wrench with an implant driver RP connection. We're almost home. One rewind and we're good. We're going to be perfect. This is the bone mill with the guide pin for the conical RP connection. And it's okay that there's no tape on it because we got a throat pack. I think that's it. Now we're going to the 2 millimeter twist drill. We can see using the all-on-4 guide that our angulation is within 30 degrees. Got good angulation. And I can also feel that this also will be the soft bone protocols. The bone's quite soft as we go through. 2.4, 2.8. We're going to take it to depth. About 13 millimeters. This is the 3.2, 3.6. I'm going to take it only about halfway because the bone is quite soft. We're going to keep it away from the depth. There. He's going to go apneic on us in a minute. No, it's wonky. You happy? I'm going to take that to about 11.5. And we're going to follow that up with a 3.236, just short of depth. The bone is a little bit more, or a little more dense in this area. We're going to go just short of depth. Still what I would consider somewhat soft. See an implant go in at 2200. You can really see the concavity in the crest too, which is good. The implant seems to be just a little bit facial in its orientation, so to correct the screw hole emergence, we're going to use a 17-degree multi-unit abutment conical connection RP 2.5 on the left front implant. We're going to place a 17-degree in the front right as well to correct for the screw hole emergence. It'll look amazing when we're finished. The tissue for it. And now we can put the cylinders on. We're going to stop for a second and put a white cap on. This is a multi-unit healing cap that we're going to place over top while we suture and get ready for the pickup of the... That's perfect. Open for me. Bite down, Arno. The way you normally bite. Close down.
Hold
Close
tight.
and hold tight. Bite tight. Stay closed. Open, Arno. That best?
Because we're going to show it in the... Okay.
We can make the hole and then we can put it back. I'm assuming they're perfect, Sue. That's why I'm just keep going. Bite down, and it is. Open. Bite down, Arnold, and just stay close biting, okay? The final prosthetic is back from the lab. We're going to insert it now. This one. And this one. And this one. We're going to have screws out in a second. You got to put it back. Open for me. Tap, 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 tap. Right up and down. Good. And bite up and down. Great. Open. I got a little heavy spot on the back molars. Maybe I want to take that down a bit. Do them in order.